What is team-based healthcare and why is it important?
So when it comes down to the veterinary practice world, the doctor only has to do three things: diagnose, prescribe, and do surgery, which means that they can delegate to the rest of the team virtually everything else within their state practice act. So in a veterinary hospital, what I understood and what I could do is I could delegate to my technicians, credentialed technicians, the different tasks that I had been doing, whether it was putting in a catheter or taking a blood sample or taking radiographs. The more that I could delegate to them, the more I could focus on building client relationships, diagnosing, prescribing, doing surgery, and the more they could delegate to assistants, the more they could focus on the job tasks of being a credentialed technician. And I really do focus on the fact that team-based healthcare, where the leader supports everybody on the team to be successful, to work to the top of their job descriptions, will lead to a much more successful and rewarding veterinary practice.
When it comes to discussing the cost of care in veterinary practice, what do you see as the biggest challenges?
As a veterinarian, I truly recognized that veterinary care is and can be expensive, but I have to believe in the value of my services, and I have to believe and communicate that to my team. And we all have to have that common belief. I also think it's very difficult for doctors in general, and veterinarians in specific, to talk about money. I think we really do want to talk about patient care and lab work and treatments and radiographs, etc. But we really don't want to spend a lot of time talking about money. So we have to either figure out a way to delegate that or be comfortable in our own skin having that conversation. You will virtually never have a conversation with an MD about the cost of their services, and even rarely with a dentist. But in veterinary care, interestingly enough, clients want that conversation from the doctor. Well, I think that the discussion of cost of veterinary care, again, fits into the team-based healthcare side of things. And I, as a doctor, want to present myself as the clinician who is most focused on the health and care of your pet, and then let my team be a part of the subsequent discussion. But they have to understand the why, which is our vision and our mission and our values, that we do everything.
What role should non-veterinarian team members play in discussing the cost of care with pet owners?
It's all about team-based healthcare. So when it comes down to what role should non-veterinarian team players, they should play an integral role. And that may be the customer service people talking to pet owners about the financial policies of the practice, the different payment options that clients have. It may be the exam room nurse or exam room advocate or technician in the room going over the estimate and explaining each line item and the services that are associated therewith. I really do think that role playing, that client experience and that cost discussion, including where the client service person comes in, the exam room nurse comes in, and the doctor comes in, is integral to building a successful cost of care system that communicates the cost and the value to the client. So what role should non-veterinary team members play in discussing the cost of care? As much of a role as the leadership believes in. And if I'm the leader, it's a very integral role from that standpoint in working with the client and working with the practice. The team should be a very important part of believing what the cost of care is and being able to communicate that clearly to the client so that the client understands the value proposition as well.
How does empowering team members to have discussions around the cost of care improve the success of the practice?
Empowering team members in general improves the success of the practice. Empowering team members to discuss the costs of care allows the doctor to become more vital in what they do as a doctor. Again, diagnose, prescribe, and do surgery, because the cost of care discussion does take time. And whether it's a basic wellness discussion or a sickness discussion, it does take time. And so by empowering the team members, by training, by communicating, by role playing, by ensuring that they understand and know what to do when you have difficult conversations, difficult clients, you have now empowered your team and given them the strength to support the practice and make decisions in the best interest of the practice and the patient and the client, so that everybody leaves happy. Now, that's not going to happen all the time, but if you start the discussions of cost of care even before the client comes in, having it on your website, having it in welcome to the practice forms, there really shouldn't be any surprises. And so I think empowering team members to have some of these conversations will eliminate some of the surprises.
Can you discuss some techniques or tools that team members can use to facilitate more successful conversations around the cost of care with pet owners?
So, first of all, the number one tool you need to have is a financial policy. You need to have an outward-facing financial policy that the clients can read and see on your website. Number two, you need financial options. What are the payment options that you are providing for clients when it comes down to paying for the cost of veterinary care? Number three, you need to train, practice, and role play, where you have staff members be difficult clients and staff members being receptionists or client service teams. You need to create a system, step by step, of how you want to have this conversation. Are you going to have it in the lobby? Are you going to have it in an exam room? Where is payment going to be taken, etc.? So I think you start with a financial policy, outward facing for the clients, inward facing for the staff. You move on to financial options. How are clients going to be able to pay? You then role play the presentation of a treatment plan, healthcare plan, estimate, however you want to call it, so that the clients are presented in a very specific fashion. It's not $287. Thank you, Mrs. Jones. It's, here are the services that we provided today. I hope you understand the importance of each and every one of them. I want to answer your questions about those services, and then we can talk about the ultimate cost. I think one of the problems we do run into is we go right to the bottom line instead of clearly delineating the services that we provided and the value proposition and how they meet the needs of the patient and why they meet the needs of the patient from that standpoint. I think empathy is extremely important, and you can't go into this conversation with a chip on your shoulders. I think you have to recognize that veterinary services, and this is part of the conversation of training, are discretionary income for pet owners. In other words, they don't have a budget for veterinary care, and so the cost of care will come from savings, it will come from credit card, it will come from things that may be used for vacations or kids. And so having this conversation and going into a communication with the client with empathy for the challenges that they face, well, it's not hard for a staff member at a veterinary hospital to be empathetic, because many of them are pet owners who are challenged by the cost of veterinary care. And then finally, the discussion of spectrum of care. I think we in the past have focused strictly on, here's the best option, go for it. You have to go into every conversation with a plan A, a plan B, and a plan C, because you don't know. So bottom line, financial policy, financial options, training, and lots of empathy for those clients. And choose the members of your team based upon personality, communication skills, who can lead the charge for conversations about cost of care. It's not everybody's strong point. Get the right people doing it, and you'll hopefully prevent problems down the road.
Are there good educational resources out there now that can help team members better prepare to have these discussions with pet owners?
AVMA has a number of tools and resources that have been created for these conversations. There are some Axon webinars that are out there. We have flip books communicating with clients. We have cards, that language that works from AVMA. All of these things are available for free. I also think a huge resource is the lifetime of care study done by CareCredit. I think there's some great foundational information in that lifetime of care study that should make for great discussions at staff meetings. Clients are nervous, 25% of clients are nervous at $250 invoices, 46% at $500 invoices. We have to have that conversation. We have to share that. And I would use those flip books from AVMA. I would use the lifetime of care study, and I would use some of the videos that AVMA has to help supplement the staff meetings that you have on talking about the cost of care.
How important are third-party financing and payment options in the discussion around cost of care?
They're more and more important as many hospitals have stopped taking checks. Very little cash is used these days, and most people have about $400 of room on their credit cards when it comes down to the ability to pay for things. So third-party financing and payment options are an imperative, but they're better utilized or introduced before there's a crisis. So one of the things that's really suggested is that third-party payment options are front and center on your website, for puppies and kittens especially, that you talk to the pet owners about applying for as much credit as they feel comfortable so that they have it when that puppy eats the pantyhose or the kitten eats the needle and thread. Because when we are put into an emergency panic situation and it's money, we don't always think straight. So I really do think that talking about third-party payment options well in advance, encouraging clients to apply early on before there's an emergency, it's the rainy day that they can pull out when they need it and say, hey, I'm not worried, I can take care of this. So I think it's exquisitely important as the number of options that practices are offering is decreasing, and especially when you take checks out of the picture.
Is there other advice that you have for veterinary team members on discussing finances with pet owners?
Put yourself in the pet owner's shoes. Go around to the front side of the counter instead of the back side of the counter. Realize how nervous they are. Realize how uncomfortable they are. Realize that their balancing act is this is part of their family. The pet is part of their family. And they'll do anything for that pet. But they also have kids, and they have loans, and they have all sorts of challenges just like you do. So I think understanding and empathizing with your clients, I think recognizing the value proposition that you bring to the table and believing in the services that your practice brings to the fore, and understanding that the doctors in your practice are there for the best interest of the client and patient, and you believe in them. Leaders, you need to build an environment where your team believes in you, and part of the team needs to all be working together, singing from the same page of music, because when you have different opinions, it creates problems. So the best advice is that everybody comes together on the team to understand how important pets are to their people, how important pet care is, both preventative and therapeutic, to the pet and to their people, how you are the provider of that pet care, and that how all of you need to believe in the value proposition, the level of care and the service that you provide, and that it comes with a price. And then you're not there trying to, as clients think, empty their wallet. What you're trying to do is save their pet and save that very vital relationship, also known as human-animal bond.